Hello, I'm William Hightower, Director of Governmental Relations for the Florida Osteopathic Medical Association, and this is your capital update for mid-session. We've passed the halfway point in the 60-day legislative session. Legislators have until May 3rd, 2013 to complete their work, but due to the 72-hour provision, they must agree on the budget and have it on legislators' desks 72 hours prior to voting on it. So in order to get it out by the last day of the session, which is May the 3rd, they must agree on the budget no later than April 30th, and it currently appears they will be able to bring it in for a landing on or before April 30th unless they run into unforeseen problems. This is a unique session in that this is the first time in many sessions that the legislators have had a surplus budget to work with, and that should bode well for the healthcare community. And speaking of the budget, both the House and Senate Appropriations Committees adopted their respective budgets this past week. Just a few days ago, the full Senate passed their proposed budget unanimously, 40-0. The House should vote on their version today. The next step in the budget process will be the House and Senate Budget Conference Committees, which will resolve the differences between the two proposed budgets. With regards to Medicaid expansion and a Medicaid alternative, both the House and Senate Select Committees on the Patient Protection and Affordable Care Act, PPACA, voted not to proceed with Medicaid expansion as permitted under the federal health care reform. However, Senator Joe Negron, chairman of the Senate Appropriations Committee, released his Medicaid alternative, which is a premium assistance program utilizing federal Medicaid funds to assist the uninsured with purchasing private insurance. Another alternative has been proposed by Senator Bean. This past week, Senate Bill 1844 was considered by the Senate Health Policy Committee. Senator Bean, the committee chairman, crafted this proposal as an additional alternative utilizing federal subsidies for the uninsured to purchase low-cost preventive options. Finally, House Speaker Will Weatherford announced that the House has developed a Medicaid alternative, and that proposal will be heard next week in week 7 of the session. Earlier in the year, Governor Scott was against Medicaid expansion, but soon changed his mind and now is actively pushing for it. On Thursday of this week, the governor came out supporting Senator Negron's version over the House version proposed by Representative Corcoran. We will keep you informed as to which version or a compromise version will win out. Some other bills that we're following that are moving through the system are HB 239, Practice of Optometry by Caldwell. This bill authorizes certified optometrists to administer and prescribe ocular pharmaceutical agents, including certain controlled substances that may be ingested orally for the relief of pain due to ocular conditions of the eye and its appendages. Currently, a certified optometrist is only permitted to administer and prescribe topical ocular pharmaceutical agents. The bill revises the definition of certified optometrist and optometry to reflect the broader authority. The bill provides a definition of ocular pharmaceutical agent. The bill provides a definition of surgery which certified optometrists are prohibited from performing. The bill passed the House and the Senate and is now awaiting action by the governor. Senate Bill 732 by Grimsley and House Bill 365 by Hudson relating to biosimilars. The FOMA is supporting this bill along with the AOA. Senate Bill 422 by Benequisto and House Bill 301 by Mayfield relating to oral parity for cancer treatment. The FOMA supports these bills along with many other organizations and associations, including the Susan G. Komen Foundation. House Bill 7015 by Metz and Senate Bill 1412 by Richner relating to expert evidence, Darbert. The FOMA, the FMA, the Florida Justice Reform Institute, and others support these bills. House Bill 625 by Renuart and Senate Bill 398 by Bean relating to physician assistants. The FOMA and the Florida Academy of Physician Assistants support Representative Renuart and these bills. House Bill 349 by Renuart and Senate Bill 248 by Thrasher relating to impaired physicians. These bills are supported by the FOMA, the FMA, the Florida Academy of Family Physicians. With over 1,700 bills filed in the House and the Senate, your FOMA legislative team has been following over 200 bills that deal with health care issues. If you would like to access any of these or other issues, please visit the FOMA website at www.foma.org. Once at the site, please go to the far right corner to Today's Important Links and click on your choice for information. Please remember also that you can visit our website for access to copies of all of our capital updates, which is a weekly review of all actions taken by the legislature. This past week, the FOMA was pleased to have Jason Prezzola, DO, and Lorian Dreyfus, DO, to serve as Doctors of the Day at the Capitol. And now, as we move forward to the last few weeks remaining in the session, we do so with a guarded, optimistic outlook for an on-time completion and a passage of a budget which will help all Floridians and legislation and be beneficial to our healthcare community, physicians, and their patients. That's our report. Thank you, and we'll see you next week.